We good? You tell me when. Are we good? You better. Of course, we are in a hospital. I'm Rodney Ellis, and I want to thank you all for being here. Each of us who are speaking will introduce ourselves as we come up. Of course, you know the head of our health department, and I'm so glad to be here with her today. I want to thank all of you for being here for a very important event. Today we stand in front of the HCA hospital, which launched the pilot program for violence interruption program a year ago in November of 2022. This was the first one. After this one, then we went to Bentop, where we had a press conference as well. So it's good to be back where it all started. And I thank the folks at HCA for making this facility available. For some, this is just one stop in the cycle of violence. We're trying to stop that cycle in its tracks. I'm proud that Harris County Public Health has partnered with Harris Health and HCA to implement violence interruption programs at Bentop Hospital and, of course, back here at HCA Hospital Northwest. Partnerships like this between hospitals and the community are one tool, just one tool that has reduced gun violence in cities and counties across the country. I want to stress it's just one of the tools in that toolbox. These programs reduce the likelihood of retaliation after a gun violence event by connecting victims at the bedside and linking them to services outside the hospital. They save lives, and they also save taxpayer dollars. Bentop treated nearly 700 gunshot victims in 2021. Harris Health spent $45 million treating gunshot victims from June 2021 to May 2022. Taxpayers cover 84% of those costs. The hospital-based gun violence program is operating successfully with results that reduce violence in our various communities, as Dr. Berry and Dr. Robinson will discuss in greater detail. Gun violence is an epidemic in America. 117 people per day in America die from gun violence. Every day, 23 children and teens are shot in the United States of America. Guns are the leading cause of death for children under 18 years of age. In Harris County, intimate partner homicides doubled from 2019 to 2022, and firearms accounted for 73% of those deaths. Americans kill each other with guns at 25 times the rate of other high-income countries. This has to stop. In Texas, the lack of policy solutions from the state is necessitating an all-out offensive at the local level. So we've rolled up our sleeves and worked on creating innovative programs to get to the root of the problem. This partnership with hospitals is just one of those. Since our community-based violence interruption programs began in 2021, our outreach specialists have stopped at least 26 shootings that we can document. Likely, they prevented many more. Each gun violence death costs taxpayers $274,000. Before even considering the devastating human toll of violence, we're talking about millions that we can save. The groundbreaking work we're doing today is part of a larger vision that imagines law enforcement agencies responding to safety threats, public safety threats, not mental health emergencies. People having access to seamless wraparound support, and when they experience crisis, all residents feel safe in their neighborhoods. This isn't just a vision board. Our budget backs it up. At Harris County, we dedicated $1.5 billion to justice and public safety, the largest allocation in the history of this county. And we've allocated millions to address homelessness, poverty, hunger, mental health, and neighborhood blight. We're committed to using any practical tools to protect Harris County residents from the epidemic of gun violence. Together, we can break this cycle. With that, I want to let Dr. Director Robinson. She is a doctor. She has a law degree. I have a law degree as well. I'm Dr. Ellis, but I'm not commissioned. Director Robinson.
Thank you. Good morning. My name is Barbie Robinson, and I'm the Executive Director of Harris County Public Health. I first want to start by thanking Commissioner Ellis for his leadership in championing public health approaches to reducing violence within our communities. Without his leadership, we would not have been able to establish our Community Health and Violence Prevention Services Division, which houses our violence prevention programming. I'm so excited and delighted to be standing here with our partners, Dr. Cherie Berry at HCA Northwest. So grateful that we're here celebrating our annual, our 1-year anniversary of launching our hospital violence intervention program here in Harris County. This program was established, it's an evidence-based program. It was established by the Hospital Alliance for Violence Intervention. It is in more than 70 jurisdictions throughout the country, and the results from this evidence-based program are bearing fruit here in Harris County. As we've seen on the national level, this model has reduced by approximately 50% the reoccurrence of violence. And how this program works is that we partner with hospital staff, hospital case management staff, as well as our outreach specialists. They come into the hospital and they work with individuals who have been the victims of gunshot wounds or stabbing. And the goal is to really reduce and prevent the reoccurrence of these types of incidents, which we know that individuals that have been a victim of violence are likely to be more likely to be a perpetrator or a victim of violence in the future. So we're grateful for all of the great work that we've done. Over the course of this last year, our program has met and worked with approximately 170 individuals in both HCA Northwest as well as Ben Taub, with 139 of those clients being here at HCA Northwest. And so we're just grateful for the work that we've been able to do in partnership. It's not enough to just disrupt a singular incident of violence. Public health approaches require that we look at the root causes of violence and work to bring the resources to address those issues, such as food assistance, housing assistance, job assistance, economic stability services, et cetera. And so with the work that we've done, we've not only worked with 139 patients here, but we've also connected them with long-term interventions, intensive wraparound services that's really changed their life trajectory as we move forward. And so I'm just delighted to continue to reduce the violence in our communities, and it is models such as these, along with our traditional programming, that allows us to have the greatest impact on community. So with that, I'll turn it over to Dr. Berry.
Thank you, Ms. Robinson, and good morning again to everyone. I am so excited that we're here celebrating our first 1-year anniversary of this program. I'm going to have to repeat what the commissioner said, that violence is a public health crisis. It's a crisis, not just in Houston, but all over the country. But I am so thrilled that we've had the support of the commissioner's office, and we've been able to work with the public health department to launch this program. Historically, trauma centers treat patients and their physical injury, and then they send them back out into the community. HCA Houston Northwest, we've been rooted in this community, and we didn't want to be passive in terms of our involvement with treating this as a public health crisis. So we were lucky enough to be able to partner with Harris County Public Health in developing this program, and it's been highly successful. To date, as of today, we've actually enrolled 170 patients in this program with a 90% acceptance rate of that program. And that's important because, as Ms. Robinson mentioned, as soon as a patient is a victim of violence, there's an increased risk for them becoming a victim of violence again, especially in urban centers. 41% of patients that suffer injury from trauma will return to the hospital within 5 years. And so as a community stakeholder, it's been important to us to make sure that we can reduce that cycle of violence. When we looked at our data prior to the start of this program, we were seeing patients coming back 2 up to 4 times as victims of violent injury. And so by implementing this program, we know that we're having an impact on patients. There have been a number of cases where we know for a fact that we've been able to halt retaliation efforts, but it's also the impact on the families. So when someone is a victim of a violent injury, it just doesn't impact them. It also impacts their family. It impacts those who witnessed that injury. So it can impact the children that are in the household. It impacts them from a financial standpoint. And it really becomes this cycle. So HCA Houston Northwest being able to break that cycle, we couldn't see a better initiative to be a part of. In the future, we would love to be able to expand our services. In this first year, we've already had to expand the age group that we cater to. So initially it was 18 to 45. We've had to expand that 15 to 68 because those are the ages that we're seeing impacted the most. We've expanded where we now have Spanish language ability. I'm very thankful for that. In the future, we want to be able to look at the data and make sure that the interventions that we're putting into place actually impact our community here, and the advocacy we're doing really touches the lives of our patients in this community. You know, we're frontline workers. We've always taken care of the injury. I'm a trauma surgeon. That's what we do. But now we're able to be frontline workers in the intervention part and not just in terms of treating the patient. And so I'll be happy to answer any questions in regard to the details of how our program works. But right now, I'm going to bring up Lupe Washington, who's the Director of Community Health and Violence Prevention Services. Thank you.
Good morning, buenos días. I'll be doing the translation in Spanish. Mi nombre es Lupe Washington, soy la directora del programa de prevención de la violencia del Departamento de Salud del Condado Harris. Estamos aquí hoy para celebrar el primer aniversario de nuestro programa que está basado aquí en este hospital. Lanzamos este programa el 1 de noviembre del año pasado y ya hemos visto que los recursos que estamos proveyendo a nuestras víctimas les están ayudando para nosotros poder prevenir próximas actas de violencia en la comunidad. Ayudamos a pacientes que llegan a nuestro hospital que son víctimas de lesiones penetrantes. Si llegan con lesiones de apuñalamientos, agresiones agravadas o tiroteos, nuestros trabajadores comunitarios están aquí. Ya cuando le dan permiso al hospital que podamos entrar a ayudarles, nuestros trabajadores entran para no simplemente proveer recursos para la víctima, sino también para proveer recursos para toda la familia que está involucrado con ese paciente. Ya hemos visto que en otras partes de nuestra nación este programa ha logrado prevenir que más del 50% de las víctimas que llegan al hospital con esos tipos de lesiones que no regresen. Y podemos decir que en nuestro condado hemos prevenido ya 26 instantes donde nuestros trabajadores han prevenido instantes que potencialmente iban a llegar a ser tiroteos en la comunidad. Estamos orgullosos de nuestro programa, pero primeramente no podría llegar a este punto sin el apoyo de nuestro comisionado Ellis. Estamos realmente agradecidos por su apoyo. También estamos agradecidos por el apoyo de este hospital, la doctora Berry, por ella llamarnos para querer hacer este programa en este hospital. Pero el programa lanzó en este hospital, pero también lanzó en el Hospital Bentab en mayo de este año. Así es que ya tenemos 2 programas en nuestro condado. Estamos aquí para ayudarles a nuestros residentes porque les queremos dar los recursos que ellos necesitan para su recuperación. No simplemente para estar allí en un día o 2 días, sino en 6 meses si todavía nos necesitan y vamos a estar aquí para ayudarles. Estamos orgullosos también porque con nuestros programas, simplemente es un programa que tenemos de los programas de nuestra división. También trabajamos en la comunidad diariamente y también tenemos otro programa de respuesta holística en nuestro condado. Pero este programa y nuestra división se ha sido parte, es parte ya del sistema ecológico de la seguridad pública en nuestro condado de Harris. Y estamos realmente orgullosos de los resultados que hemos tenido y esperamos que ya podamos expandir nuestros servicios a otros hospitales, pero también expandir lo que estamos haciendo con nuestros 2 hospitales aquí en el condado de Harris. Así es que le damos las gracias por estar aquí y si tienen preguntas pueden hacer sus preguntas ya después. Muchísimas gracias.
We'll take any questions that you might have. Yes.
Sí, cuando una víctima llega a este hospital, los doctores aquí le piden permiso al paciente, les hablan sobre nuestro programa y si nos dan permiso, nuestras trabajadoras llegan para hablar con la familia, a ver qué recursos se necesitan y para nosotros asegurarnos que van a tener esos recursos en cuanto salgan del hospital. Y no simplemente trabajamos con esa víctima, sino vamos a trabajar con la familia. Los que necesiten y quieran ayuda, vamos a estar aquí para ayudarles a ellos. Pero el doctor o la doctora que los está atendiendo tienen que obtener permiso para nosotros poder venir a hablar con ellos primero. Lo que se necesite, porque no simplemente somos nuestro programa, sino en nuestro departamento, si nosotros no podemos encontrar los recursos aquí que se necesiten, tenemos otro programa, Access Harris, en nuestro departamento, donde los podemos referir y ahí también tienen trabajadores que les van a ayudar con esos recursos, así es que no es simplemente un día le vamos a ayudar y nos vamos a olvidar de ellos, no, estamos aquí para ayudarles, si son 3 meses, 6 meses, lo que ellos necesiten.
So tell the rest of us who are working on our Spanish.
Yeah.
Tell us the question then.
Yeah, so she asked, exactly how the program worked, and our victims that come in with these penetrating injuries, the doctors here will obtain consent to allow us permission to come in and speak to the patients. And we not only speak to the patients, but their family members that are with them. And we're here to provide the long-term resources that they need, not just on day one, what they're gonna need immediately, but to be here for the long term. If there's going to be long-term coordinated care that's needed, we have another fabulous division at Harris County Public Health called Access Harris, and they're here to provide that long-term coordinated care for these victims and their family members.
I think you had another one. I might cut you off.
Su próxima pregunta, ¿qué? En este hospital hemos ayudado a 139 pacientes en este hospital y en el hospital de Bentab hemos ayudado a 39 pacientes o a 31 pacientes. Ya casi los 170, pero tenemos 4 hoy esperando a ver si nos van a dar el permiso para poder hablar con ellos hoy. And she asked how many we've been able to assist. And here at this hospital, it's been 139, and at Bentab, it's about 39, 31. And we do have 4 patients here at the hospital today that we're waiting to obtain consent on to be able to see.
Any other questions?
Doctor, can you speak a little bit more about what she was talking about in terms of what you actually do to prevent the violence from happening again?
Right, so by preventing in this program, as trauma surgeons, we're in a unique position because we're oftentimes the first person that a patient will see after they suffer an injury from violence. And that's a window of opportunity for us because they're vulnerable. And so by us being there at the bedside at that time, we're able to intervene at a time when they might be welcome to hearing about risk reduction strategies, prevention, changes in lifestyle, and that's where we would ask them if they would want to participate in the program, and we would introduce them to what are called credible messengers. So the people that come out and speak to the patients are outreach specialists. They are ingrained in the community, they're familiar with the community, and so they can actually come to the bedside, talk to the patient in a way that's understanding for them, and then really get in tune with what services they would benefit that would help reduce the chance that they would be involved in a similar incident or any type of violent incident in the future. And so that varies per patient. That might be job resources, that might be a safer living environment, assistance with employment, Mental health is a huge factor in this. By implementing this program, we have seen a drastic increase in the offering of mental health services to our patients, which we know is a huge factor, not just with their physical healing, but with their holistic healing, being victims of trauma.
Any others?
And Commissioner Ellis, in terms of funding, how long will the program be able to be viable?
We did this with federal money. When the ARPA money runs out, I hope that the programs will be ingrained enough in the community with enough statistical data. We'll have learned from what we've done, and we will have learned from what other jurisdictions around the country are doing. And then we will have to make a decision as to whether or not the people in Harris County think it's worthwhile and they're willing to support it. I hope that they will be. I plan to advocate for it, but so that's why it's so important that, you know, Dr. Berry, Lupe, and Dr. Robinson really collect the data, and if it works well and there's community support, I think that I can get my colleagues on Commissioners Court to support it. We picked the two neighborhoods where the crime statistics were the worst. One is the neighborhood I came out of, Sunnyside. The other one is this neighborhood. I happen to represent both. I'm hoping that my colleagues are looking at expanding it to other parts, but it's all about the money. But we are using federal money now. You want to add to that?
No, just that, as we mentioned, you know, the program is already paid for itself in terms of the number of incidents of violence that we've been able to disrupt. And as Commissioner said, right, to really show the efficacy of the program, it takes time, right? We don't want folks to become repeat victims or perpetrators of violence. And so we look at that over an extended period of time, but we're confident that we'll be able to demonstrate the value of the program.
And we did get a federal grant. It's
Yes,
about $2 million.
yes, from the Department of Justice for our violence intervention program.
In addition to the money we're already getting from the Biden-Harris administration, ARPA funds. Any others? Okay, thank you all, and thank you all. You're doing a great job.
Thank you.
Good to be back out here. Thank you very much.
Thank
All right, thank you.